Welcome to a Business Minute with Lily Lopez, presented by the South Florida Hispanic Chamber of Commerce. Today, we're very pleased to have with us Dr. Andy Arwari. Dr. Arwari is Medical Director for VITAS Healthcare in Miami, Florida, where he oversees hospice and palliative care services for patients in their homes, nursing homes, assisted living communities, and inpatient units throughout Miami-Dade and Monroe counties. Dr. Arwari consults with patients, attending physicians. He supervises VITAS team physicians, guides staff, and serves as a resource to healthcare professionals on the benefits of hospice and palliative care for patients and their families. Dr. Awari is board certified in internal medicine, hospice, and palliative medicine, and as a hospice medical director. So, welcome, Dr. Awari, to a Business Minute with Lily Lopez. What a pleasure to have you here today. And we were having a small conversation prior to the interview because I said, "Where's your name from?" I read in your bio that you're from Argentina, and because the last name is Arwari, so you're Italian, um, from India and Argentina, right?
Right, exactly. I have a whole lot of international background, I guess I could put it that
That's
way.
great. I think that's wonderful. So welcome and so happy
Thank
to
you, Lizzie.
have you on my show. And as I was saying to you, we work with Vitas. I mean, they've been supporting member of the South Florida Hispanic Chamber for at least 15 years. So with Betty Bell and Maria Hidalgo, I mean, it's been a relationship. I have used the services of Vitas with my father, and may he rest in peace. But I remember that the service was just amazing. I mean, the quality and the compassion. Those are difficult moments when you need hospice. So let's start by just a simple question: what is hospice?
When hospice patients with advanced illness present with challenging symptoms that require high acuity care, the VITAS Inpatient Hospice Unit at MedSquare Kendall specializes in complex modalities that provide comfort and help patients avoid readmission to the ED or hospital. Specially trained hospice nurses, respiratory therapists, a dedicated oncology task force, and board-certified hospice and palliative care physicians oversee a variety of modalities to manage distressing end-of-life symptoms. These include shortness of breath, pain, infection, agitation, nausea and vomiting, delirium, edema, and more. Some interventions may require a clinical case discussion between the VITAS medical director and patient's attending physician. Refer your patients now.
For those that have never had to hear that word, because a lot of people don't know about hospice until they have a loved one that's terminal.
Right, and so I would start by saying that hospice is the continuation of care. And it's a little complex because hospice is part of a part of Medicare benefit. So it is an entitlement program that patients who are Medicare eligible have access to, and it should never be viewed as the stopping of care. It's a transition of taking care in a different way,
Right.
and maybe dispelling the myth a little bit about the fact that when you're under hospice, services actually get intensified.
Right.
So more services are actually brought into the care of patients, and now we're also including families. And what's important to highlight about hospice is it's provided by an interdisciplinary care team. So it's not just a doctor, it's not a nurse, it's a doctor, a nurse, a social worker, a chaplain, pharmacist, music therapy, massage therapy, home health aides. There's a whole team that comes together to provide hospice for patients and their loved ones. So that's really the important distinction here, that it's not only for patients, it's for the entire family, the immediate family that surrounds and provides care to that patient. And so we are supporting the patient and their families. Of course, what's important to highlight is the fact that patients that have elected their hospice benefit, because it is an election, have a prognosis of usually 6 months or less. Um, what we focus though is making sure that in the time that they have, whatever that may be, we are we're focusing on their quality of life.
And in the entire family, because I do
and the
remember
entire family.
entire family, because those are very difficult moments, and so that's done very, very, very well and managed by Vitas very well, and I was very satisfied with the services. So you were talking about music therapy and massage, and I also read pet visits. So tell me,
Yes.
how do you incorporate the pet visits? What do they do? They make, of course, they make people happy, right?
Yes, absolutely.
I hadn't heard of that. I hadn't heard of pet visits.
Yes, and so we, there's therapy dogs, and it's not just addressing the physical
Right.
aspect of patient care. It's also addressing their spiritual, their social aspect, so that it's really a holistic mode of care. And I think that's the surprising part to patients and families when they come to realize, wow, I didn't realize that this really was what hospice, because there's a lot of myths out there about what hospice means and what it is. And the common misconception is that,
Right.
well, this means that we're giving up, we're stopping things. And what's very interesting is that we do things in hospice that are in a way a continuation of what patients are used to. And our philosophy is really to make sure that patients who have distressing symptoms, those symptoms are addressed, and that they're not suffering and they're not in distress. And as a halo effect, as I say, the family's also being supported in that, right? To see their loved one that is being supported and is being managed and cared for in a way that's in all aspects, in I would say very humanistic way of caring for someone.
Yes, yes. And the presence of Vitas in South Florida is huge. Tell me a little bit about that big presence, because I know you have several buildings and a lot of staff. So tell me about all the people that work in Vitas, and you as a medical director must work with so many doctors and so many different people in the medical field. So how does it feel? How does it feel to be here in South Florida? Because you're from Illinois.
Yes. So it's program 11, which is the program I'm with. I'm fortunate to be a part of a team um, I, with GMs and patient care advocates and other medical directors. There's four of us, and we are the largest program in VITAS. And so our focus is to deliver the care in the patient's home. So our staff, the equipment that we have is really towards making sure that that patient can stay at home with their loved one, and we provide the support in their home. Um, there, that's another myth that sometimes exists, that hospice is only in the home. And so that's not entirely true. And I wanted to explain that.
Mhm.
There are actually four levels of hospice care. And so the basic one, the one that we're commonly used to, is the one that we provide in someone's home. Um, Now, if there is what we call a symptom crisis, where someone is having a distressing symptom and they need that extra support, we are able to provide that support by sending the resources to the patient's home. So that may mean that we can provide a nurse or a health aide, someone that can stay with the patient until that symptom is resolved. And if that still requires more care, we actually have what we call our inpatient units, or IPUs. And here in South Florida, we have 6 of them in Dade-Monroe County.
Mhm.
And what we can do is we can actually pull a patient into those units and provide the level of support that those patients may need. Of course, always in the context of making sure that it's in alignment with the patient's wishes and values, right? We don't do things that really would not be aligned with those wishes and values. But that's another myth sometimes that maybe is out there, that well, you're just going to stay home, and if you're having the stress, they won't help you. On the contrary, we have all the means that we can help these patients. We have here in South Florida one of a freestanding hospice unit just in Kendall that was recently opened, and I think that's very exciting.
I went to the grand opening. It was beautiful. It's a beautiful
Yes, and
facility. Uh-huh.
it's a beautiful facility, and the nice thing is that family can be with their loved one. It's unlike a hospital where there's restrictions. Families can visit and they can be present, and so all of these things our staff supports this, and that's why we are a very big program.
Oh, wow. Yeah. I was very impressed. That's a facility. It was so beautiful. It's a luxury hotel, basically. It was amazing. I loved it. And one question, are you hiring? Vita's hiring? Because I know that nowadays there's a lot of people need, I mean, companies are looking for employees and there's a shortage. And so what's happening with Vita's? Vita's is,
Yes, we are hiring. Absolutely. We have a lot of openings for nurses and for health aides. Um, and I think that, I would welcome nurses and health aides to explore VITAS. And I would, we have the VITAS dot jobs website, www.vitas jobs. And there's videos there where they can kind of get a sense of what it's like. And I would say that, it's a very rewarding field, because again, we are working as a team, and that's the important concept that I think that I would highlight to anyone. What is hospice? It's a team approach to patient care. So it's unlike what you would normally see in the traditional healthcare, as I call it, right? It's the ideal, and so I think that for anyone who wants to be part of a team and provide meaningful care for patients and their families, especially at that vulnerable time, this is a great field, and Vitas really is a great company to work for.
yes, it is. Well, thank you. Thank you, Dr. Awari, for being on a business minute with Lily Lopez. And I'll see everyone next week at the same time.
My pleasure. Thank you so much.